Nearly 7% of adults in the U.S. experience depression. More than 18% experience anxiety. Mental health issues are more common than you might think.
May is Mental Health Month, and it's a time for our communities and our country to actually pay attention to our mental health. Our heads are actually connected to the rest of our body, and we often don't think about it.
Mental health is often less talked about and less understood because it is harder to see.
So 1 in 5 people will be impacted by a mental illness. So it's pretty hard to think that any individual out there won't have a family member or a close friend or a coworker that isn't experiencing some form of mental illness, whether it's depression, anxiety, schizophrenia, ADHD, one of those. And so I think what I would kind of ask people to do is to think about, so how do you interact with them? Do you provide support when they're having a tough time?
This week, the Compassion Action Network held a community forum to talk about mental health and how our society can do more to help. For example, there are simple ways you might be able to help someone you know with depression.
Well, if you're living with depression, it's pretty hard to reach out. You're not feeling good about yourself. You may not really have any energy to do that. And so I would say, text that person, call that person and say, it's a beautiful day. Why don't we go for a walk? Walks are really beneficial because it gets the endorphins moving in your brain. So, even if it's just a short walk around the block, some way to get them out of their home and engaging with someone.
And beyond simply engaging them, sometimes helping to provide a basic need can go a long way.
You might also think about bringing a meal to them. It can be pretty hard to get the energy up to actually, cook that meal or buy those groceries. And so doing something like that could really be beneficial to someone.
Another way to help would be to understand some common misconceptions about mental illness.
So there's a couple misconceptions. One is that we tend to focus on adult mental health. But actually, half of all adults who live with a serious mental illness begin experiencing symptoms before the age of 14, 75% by the age of 26. So if we don't focus on children's mental health, we really miss the boat. The other thing that people often say is someone with a mental illness is violent, and yet only 4% of the violent crimes committed in our country are committed by someone who lives with a mental illness. And the more that we equate violence and mental illness, the more difficult it is for someone to go out and seek treatment, which is what we want them to do and which actually prevents violence.
Changing your vocabulary can also be a help.
When we think of words that we use to describe people with mental illness, they're generally not nice words, crazy, deranged, things like that. But we really should think about things like courage. It takes a lot of courage to live with schizophrenia, hear those negative voices all the time, and go out in the community. Determination, someone with depression who does get out of bed and does get to work or takes care of their children takes an incredible amount of determination. And we just don't tend to use those same words and view mental illness in the same way as we do other healthcare conditions.
And for those who deal with a mental illness, or those who think they might have a symptom of anxiety, depression, or something else, Sue reminds everyone that, like all illnesses, a real diagnosis and real treatment do help.
What we know for any healthcare condition is early identification and treatment leads to the best outcomes. And unfortunately, people with mental illness live with their symptoms an average of 10 years before seeking help. So you can imagine, frankly, all the bad things that can happen during that time. Even a young person experiencing their first psychotic episode, so they're hearing voices, seeing things that aren't there, they wait an average of 74 weeks. So we really want people to go in early when they're feeling something. And you can do a simple even depression screen. Most actually clinics will do that. And a screen is not an assessment. A screen is just kind of like a thermometer. It might tell you if you're running a fever or not. It doesn't tell you what the illness is. So if you're running a fever, on a depression screen, then you need to go to the next step and actually get an assessment and find out, are you really living with depression? Have you caught it early enough so you can do, therapy and not include medications? But people really need to get these illnesses treated early.
Asking for help can be scary. Seeking treatment can be tough. But taking the first step can mean that things will get better.
I think we can be scared of a lot of healthcare conditions that people put off, and of course this is certainly one of them. But some of the signs and symptoms are really things like changes in what you do. Sleeping too much, sleeping too little. Eating too much, eating too little. Not enjoying things that you used to do before, whether it was golf or your book club or whatever it might be. And so when you see those changes, again, you should get treatment. And therapy is really about changing the way that you view yourself in the world. So one example might be, if you have a teenager who doesn't do well in a test and they come home and they say, I'm a horrible person, I'm really stupid, I'm not smart, I can't do this work. In therapy, they would learn to not make it about themselves and to really look at the situation differently. Instead of saying they're a bad person, they might say, maybe there's a different way I could have studied for this. So not to kind of do those negative self-thoughts. And it really does, it works, absolutely works.
For North Metro TV News, Danica Peterson reporting.